Hello, my name is Holly Taggart. As part of the HSA 6117 class, I will be discussing rural American populations in terms of vulnerability in healthcare. According to Shi and Singh, several factors affect access to healthcare and fundamentally affect a person's risk for contracting illness or disability. These factors include predisposing, enabling, and need characteristics at both an ecological and individual level. I'll be using this framework to highlight the health challenges faced by rural Americans. If the United States were 100 people, 82 would live in an urban environment and 18 in a rural area. This map shows current U.S. population in terms of rural and urban settings. Out of these 100 people, 2.4 would be physicians. As shown on the map, more doctors practice in urban areas. Rural Americans clearly have less access to physician care than their urban counterparts, and geography, as an ecological factor, has an important predisposing effect on how rural Americans access care. Rural residents must travel further for care, particularly for specialist services. This is a burden in terms of both time and money. While geographic location is the most obvious rural health challenge, it isn't the only factor that affects how rural Americans access healthcare. Predisposing individual characteristics include factors such as race, gender, and age. Rural areas are often thought to be healthier due to ideas of fresh air, good country living, or farm fresh produce. However, when compared with urban counterparts, residents of rural counties are actually older, poorer, less educated, and sicker, with a higher percentage of residents living with activity limitations due to chronic health conditions. People living in rural America rely more heavily on the federal food stamp program. They are nearly twice as likely to die from unintentional injuries and are at a significantly higher risk of death by gunshot than urban residents. Rural residents who are minorities are noted to have even lower life expectancy than Caucasian residents. Life expectancy decreases as the level of rurality increases, so the more remote an area is, the lower the life expectancy. Enabling characteristics are means that individuals have to obtain health services. These are often factors that are most responsive to policy change. On an ecological level, enabling factors include the healthcare system itself. Rural Americans face a shortage of healthcare providers. Geographic maldistribution of providers is a prominent characteristic of the American healthcare system. In addition, many rural Americans rely on smaller or critical access hospitals for care. Due to changes in reimbursement, many of these hospitals have closed. Hospital closings lead to delays in care, especially for emergency services. This can lead to adverse outcomes. A specific health system concern among rural Americans is that of privacy. In rural areas, there is little anonymity. Residents may be concerned about seeking care due to personal relationships with healthcare workers or about being seen by other community residents utilizing certain services, such as behavioral health services or reproductive health services. There are several programs in place to address these health system shortfalls. These include offices of rural health in all 50 states, the National Health Service Corps, and designation of areas as medically underserved areas or MUAs, and increasing assistance to these MUA areas. While progress has been made, these areas will continue to have barriers that will continue to require special programs assisting with training and support for the foreseeable future. On an individual level, some important identified enabling aspects include income, insurance status, education, including language and health literacy, and transportation. Persons with low incomes are not a rural phenomenon. Despite this, the average per capita income is $7,417 lower than in urban areas. Rural Americans are more likely to live below the poverty level. The disparity in incomes is even greater for minorities living in rural areas. A person with less income will make differing choices regarding health care. This may include foregoing primary care visits or delaying care for other conditions. Rural populations have a larger proportion of low-income residents who could benefit from the Affordable Care Act to receive health insurance coverage. However, nearly two-thirds of uninsured rural individuals live in a state which chose not to expand Medicaid, meaning that these individuals have fewer affordable health insurance choices, and many are foregoing health insurance and choosing to pay the less expensive penalty instead. As has been discussed previously, people in rural areas usually travel long distances to access healthcare services. Reliable means of transport can sometimes make all the difference in a person attending appointments and treatments regularly. As many rural areas lack affordable public transportation, residents without reliable transport are at a distinct disadvantage when it comes to accessing health care. Rural residents tend to have lower education levels when compared to urban residents. This places residents at risk for low health literacy. Health literacy is the degree to which patients understand basic health information regarding healthy behaviors or treatment plans. This is intensified for persons with limited English proficiency. While there are many ways to address these educational issues, they will continue to affect the ways in which rural Americans access healthcare for the foreseeable future. Within this framework, need refers to self-perceived health status on both an individual and ecological level. Ecologically, need is identified by examining community health indicators such as mortality, morbidity, and quality of life measures. Individually, need refers to an individual's ability to participate in activities of daily living, self-evaluated physical and mental health, and to the health of subpopulations within an area, such as persons with mental illness, immigrants, chronically ill persons, or high-risk persons such as mothers and infants. As we've discussed, statistically rural residents are older, poorer, and less educated. Mortality statistics show that on average, rural persons of all ethnicities die about 2 years earlier than urban residents. For minority rural residents, this difference is more pronounced. On an individual level, Shi and Singh note that rural Americans are more likely to evaluate themselves as less healthy than their urban counterparts, with more subjective complaints such as headaches and backaches. I've discussed various ecological and individual predisposing, enabling, and need characteristics of rural American communities. It is not just the factors that create less optimal health outcomes for rural Americans. In fact, many factors discussed here also affect urban residents. It is the interplay between these variables and ecological variables that create levels of risk for individuals living in these situations. Shi and Singh note that persons who have multiple identified risks, for example more than 2, usually experience inferior health status, lower quality of care, or poor access to care. Addressing the challenges of healthcare delivery in rural America is not insurmountable. The challenges faced by rural Americans are multifaceted, and solutions will need to involve a range of practical and complementary approaches. New innovations, such as telemedicine and in-home monitoring, combined with ongoing programs to address particular individual vulnerabilities, are beginning to address many of the needs of rural communities to ensure that regardless of where a person lives, they can access quality care at a reasonable cost. How would you rate the efforts made to reduce health disparities faced by rural Americans? Which areas would you focus on improving?